Hey, this is Dr. John Conde, Board Certified Chiropractic Neurologist at the Conde Center. This is our first inaugural vlog, and I want to thank you for joining me. We're going to be talking about a lot of different neurological conditions, things that may affect you, things that may affect a loved one, a friend, family member, and we're going to talk about what causes it, how it's diagnosed, how we treat it, and maybe even some practical strategies that you can incorporate on day one to help you get better. Today, what I want to talk to you about is vertigo. What is it? Vertigo is a subtype of dizziness. That means dizziness is a broad category, and there are many different types of dizziness. We're going to focus in on vertigo. Most people think vertigo and dizziness are synonymous. They're not. So I'm going to kind of make that distinction today so you understand. Vertigo literally means an internal or external spinning sensation. You can feel like you're spinning. It does not mean feeling off balance or lightheaded or that type of thing. It literally means you're spinning. And usually the spinning occurs when you do any kind of rapid head movements or body movements or things like that. That spinning sensation can be accompanied by nausea, you want to throw up, or headache, or it could be also accompanied by some neck pain, okay? But the actual dizziness itself that you experience with vertigo is a true sensation like you are in a carnival, okay, where you're spinning around. 40% of adults in the United States are going to experience vertigo at some point in their life. Usually women, a little bit more than men, but happens to everybody. In terms of age, vertigo doesn't really discriminate with that. Anybody can get it, but we do see a little bit of a higher propensity for people over 50, especially as we start to get to 60 and 70. So what causes vertigo? The most common cause of vertigo is something called BPPV, benign paroxysmal positional vertigo. This is when calcium carbonate crystals detach from the inner ear tubules and start to float freely within the inner ear. When this occurs, these little calcium crystals start to impact something called hair cells, and it starts to make your brain think like you're spinning. Usually we see an accompanied movement of the eyes involuntarily called nystagmus, okay? And if you're super dizzy and you got true vertigo, sometimes going to a mirror and seeing your eyes move, you can see that, hey, something's going wrong. That's usually normal with this condition. So BPPV is the most common cause, right? And why do those crystals become detached? Well, it can be from a head injury where you literally jostle it loose, or it can be from just sometimes as we get older, those crystals get a little bit easier to come off. Sometimes we see it, what we call idiopathic. There's no real understanding why it happens. It just occurs and it detaches. That's not the only cause of vertigo, okay? There are many other causes of vertigo. Some can be due to a specific type of head injury. So if you have a concussion or you have a traumatic brain injury, like, you know, if you're playing a sport, or if you take a fall and you take a spill and you hit your head, that can definitely cause it. Sometimes we find tumors that can cause vertigo. Very rare, though, for that to happen, but it can. If you have a severe infection of a nerve that attacks the nerves in the inner ear, that can cause vertigo. We call that a vestibular neuritis or a labyrinthitis, okay? Sometimes you can get a dilation of the tubules in the inner ear. That can happen. So you can see that there's many different causes for vertigo. Sometimes vertigo can even be caused by issues with your neck, whether it be arthritis, degeneration, whiplash from an auto accident. So there's different things that can produce it, but the most common cause is BPPV. How is vertigo diagnosed? Well, there are plenty of ways that we can look at vertigo. I mean, there's some more low-tech ways where we use a procedure called the Dix-Hallpike maneuver, where we lie you down, move your head around, and we want to see if there's any kind of motion, involuntary motion we call nystagmus with your eyes. We can do a supine barrel roll where you lie on your back and we turn your head, again, looking for the eyes. And all we're trying to do with these tests is move those crystals around a little bit more so we can really have them trigger that hair cell so your eyes start to move, and we can really confirm that it's that type of vertigo. However, we can also look at vertigo using more high-tech equipment that's a little bit more detailed oriented, and we can really get a better diagnosis. Sometimes we'll use goggles on you, and this procedure is called video oculography. And what these goggles do is that it helps to measure eye movements. It helps to bring about and allows us to see the subtle involuntary movement of the eyes that a lot of times you can't really see by just having your own eyes look at the patient's eyes. So we put these goggles on and we can really do different tests to determine and confirm that there's vertigo. All in all, we do all of these procedures. We can really come up with a good functional diagnosis. And then really the most important part about it is how do we treat it, right? If it is BPPV, how do we treat it? If it's a different cause of the vertigo, how do we treat it? And that's what we're going to get into here in just a moment. What I want to discuss right now is how vertigo is treated, right? We talked about, what is it, who gets it, how it's diagnosed. But now I want to talk to you about how we actually treat this thing called vertigo. Well, it all really depends on the etiology or the origin of it, what's producing it. If it's BPPV, like we talked about earlier, where it's a crystal in the inner ear that's floating around, well, we could do something called an Epley's maneuver or a variation of the Epley's maneuver. There's a couple different types of maneuvers that we do with the head that we can actually help to reposition that crystal in a part of the inner ear canal where the little enzymes can chew up those crystals. And a lot of times we can fix the dizziness just by doing either an Epley's maneuver or a supine barrel roll. There's a bunch of different maneuvers that we'll use. Quite often though, even though we fix it with getting rid of the crystal, a lot of times the system doesn't really recalibrate properly. So you have the area that had the crystal kind of really working at a high level, the other area working a little lower. So sometimes we need to do a little bit of therapy, exercise, to bring one side up to meet the level of the other side so that we have kind of a symmetrical firing from both sides of the inner ear so that the brain is more balanced and it's not getting all different types of levels of information. Okay. If the cause is what we call central, meaning that it's not due to a crystal in the inner ear or anything like that, but it's due to either a traumatic head injury where you've actually caused injury to the brain, or if it's due to infection in the actual some of these nerves in the inner ear. Well, that can affect more the actual connection between the nerve and the brain. So there's variations to this, but we can kind of break these up into a peripheral and a central. The peripheral will be considered that BPPV we talked about. The central, again, from concussions, from stroke, from maybe MS or different disorders that can cause that. The treatments are a little different. For the central mechanisms, it's really heavy on therapy, exercise, rehabilitation. We use a term that's really exploded in the 21st century called neuroplasticity. That means that we can make change in these neurological pathways by literally activating the pathway. The neurons get healthier when you exercise them. It's really just a sensational breakthrough that we've really been exploring over the last 20 years and using it for different variations of these conditions. But for these central vertigos that are not due to a crystal in the inner ear, we can do these rehab mechanisms and really help the person and really get them back, and these are curative therapies. So that's how we kind of work on that and kind of approach those types of vertigos. Thank you so much for joining me on the vlog today. If you like what you heard, please like and subscribe below. If you have any topics that you want me to talk about or to dig deeper into, please email us at info@thecondecenter.com. I'd love to be able to do some research and do some things that I can kind of help you guide you through whatever problem you're dealing with.